Hello everyone. Today we'll be discussing about urinary catheterization. In this section, we'll discuss about two urinary catheterization, that is male urinary catheterization as well as a female urinary catheterization. At the same time, we'll cover the topics such as definition of urinary catheterization, indication and contraindication of urinary catheterization, size of the catheter that needs to be used, the technique or the method that need to be adopted for the catheterization, the pros and cons of the urinary catheterization, the complication that can be developed after the catheterization, and the utility of the urinary catheterization. And after all, we'll also discuss, according to the Centers of Disease Control, the guidelines which are given for the catheterization. So these topics will be covered in the urinary catheterization. So moving with the definition, the procedure of inserting a drainage tube into the urinary bladder is called as the urinary catheterization. That is a very simple definition where a tube or a drainage tube is introduced into the urinary bladder to drain the urine from the bladder. So this is definition of urinary catheterization. So why this urinary catheterization has to be done? So urinary catheterization has to be done in order to drain the urine from the bladder in patients who are incontinent or have an obstruction. So in both the condition, if a incontinence is there, there will be dribbling of the urine. So that may need to be catheterized. At the same time, urinary obstruction, no doubt this has to be catheterized. In both the condition, it need to be catheterized. And the third one, to frequently monitor the urine output as a proxy for a renal function. So it is a proxy for the renal function wherein patient, if at all not giving properly the output of the input and the output cannot be maintained properly, in such condition the input and the output can be maintained by inserting a catheter and measuring how much the urine has passed and how much the fluid has taken inside. So this is a proxy for the renal function. At the same time, long-term catheterization is not advisable as it is associated with the risk of urinary tract infection. So urinary catheter insertion uh, uh, is done to do all the above said things. That is, one is to relieve the obstruction, to aid the incontinence, and to measure the output. So moving on, indication and contraindication of the catheterization. So indication, that is a preoperative urinary drainage, urinary tract outflow obstruction, and urinary volume measurement in intensive care unit. As I said earlier, perioperative urinary drainage. So as a part and parcel of the operative procedure, it can be given for the drainage of the urine. Say that the person needs to be undergoing a surgery and the urinary tract has to be kept patent, so that a drainage has to be inserted. In such condition, as a part of perioperative urinary drainage, this will be inserted. Second, urinary tract outflow obstruction. If there is an obstruction due to any cause and the physician or urologist feels that there it has to be catheterized, then it need to be catheterized. Then urinary volume measurement in intensive care units. So we know that in intensive care unit, patient will be in a vegetative state most of the time, or in patient will not be able to give an output properly. In such condition, urinary catheterization is done to measure the output. And the contraindication, in all the condition where there is a urethral disruption, in such condition urinary catheterization is contraindicated. So before going to the actual the procedure how a catheterization is done, so we have to identify the different size of the catheters. So the size of the catheter is not done here by millimeters or the centimeter, it is done in the measurement of French. FR stands for French. So French is the unit of measurement used in sizing the urinary catheters, where one French is equal to 1/3 of a millimeter. Now we will not tell it in a matter of centimeter, millimeter or anything. Rather we will tell it in the form of French. So 1 French stands for 1/3 of a millimeter. Now we catheterize depending upon different size of the catheter, different French size of the catheters. Smaller catheters 12 to 14 French, medium catheters 16 to 18 French, larger catheter 20 to 24 French. So this need to be understood. The smaller catheters, that is 12 to 14 French, is used in the is appropriate for the use in patients with the strictures. Medium catheters, that is 16 to 18 French, typically used in adult males. Larger catheters 20 to 24 French may be used in the patients with a prostatic hypertrophy or hematuria. So these are the different size of the catheters depending upon the French unit. So now moving on with the method or the technique that is adopted for the catheterization. So as a part of the procedure, pre-operative procedure, that is prior to the urinary catheterization, patient consent should be obtained. So the patient consent should be obtained. The urethra and the surrounding areas is prepared and draped as universal protocol is performed. So all the surgical preoperative draping procedure is also followed here. The operator or one who does the procedure should wash his hands and wear a sterile glove. So this has to be done in a sterile glove. Catheter should only be inserted by a trained person. This is according to the guidelines. So this is according to the guidelines wherein a trained personnel should do this. Then catheter should only be inserted when it is necessary. So if a physician or a urologist feel that this or a surgeon feels that this has to be catheterized, then only it is suggested rather than for the convenience of the patient care personnel. So it is not suggested in such condition where a patient care personnel say that so catheterize them so that it is very difficult for the patient care personnel to look after it. So as we have identified that a long-term catheterization may cause many of the complications including the infections. So this is not advised. So further, if at all catheterization has to be done, alternative methods of urinary drainage should be obtained or entertained, such as a condom catheterization or a suprapubic drainage tube. So these are the other alternative methods that can be entertained in so to prevent the urinary catheterization or urethral catheterization. So as far as it can be postponed, that has to be postponed. Then the smallest appropriate catheter should be selected for the insertion. So why this has to be done? Because so as it has to be kept for a longer duration of time, it may widen the urethra. Uh, urethra. So as far as possible, the smaller catheter should be selected, and the balloon is checked for the patency. Before inserting, the balloon has to be checked. If the patient is circumcised, the foreskin should be retracted prior to the skin preparation. So not on the skin or the prepuce it has to be draped, rather the skin is retracted, then draping is done. The catheter should be lubricated and inserted into the urethra and advanced to its full length, while the penis is held in a vertical with a non-dominant hand. So in one hand, a penis has to be held in a vertical position, and from the other hand, lubricated catheter has to be inserted to its fuller length. After urine has drained from the catheter, so while inserting, the urine can be obtained into the urine can be seen draining out. So at that particular point, so balloon should be inflated. So 20 to 30 cc of uh, sterile water has to be injected and it has to be inflated. If the foreskin has been retracted, it should be reduced to anatomical position. So it should be made normal. So if at all the skin is retracted first. The catheter is attached to the closed drainage system and drainage bag. So this should not be kept open, rather this should be put into closed drainage system and the drainage bag positioned below the level of bladder. So it should not be done that the uro bag is kept above the level of the bladder. So it is gravity dependent. So it has to be kept below the level of bladder to prevent the urinary reflux into the bladder. So now moving with the pros and cons, clinical pearls and pitfalls of catheterization. So when catheter passage is difficult, this may be due to one of the several problems, including meatal stenosis, urethral stricture, and prostatic hypertrophy. So stenosis or the strictures may be managed by the passage of smaller catheter. Patient with a prostatic hypertrophy may be successfully catheterized with a larger catheter or a code-tipped catheter, which is stiffer and which is having an asymmetric tip. The urethra can be distended and lubricated with a lubricant when passage is difficult. If no urine drains from the catheter after insertion to an appropriate length, the catheter may be irrigated with a sterile saline. So free saline return suggests that the tip is in the right location. So these are some of the pros and cons you need to be identified. So one is meatal stenosis, urethral stricture, as well as the prostatic hypertrophy. So moving on with the complication. So urethral trauma is one complication wherein if at all catheter is not fully inserted into its position and in between it is inflated, in such condition urethral rupture or urethral trauma occurs, which may end up in the stricture urethrae. So stricture urethrae that should not occur. So that's why care has to be taken. At the same time, infection. As I said earlier, long-term catheterization is associated with increased risk of urinary tract infection. So as far as possible, so urethral catheterization should not be encouraged. So only if it is inevitable, then only it is performed. Why? Because as it is a structure which is inserted into the system and for a longer duration of time it stays there, there may be a chance that there will be urinary tract infection due to this particular catheter. So these are some of the complications. So after this, we'll move on to the female urinary catheterization. So just now we discussed about the male urinary catheterization. Now we'll discuss about the female urinary catheterization. Prior to the urinary catheterization, patient consent should be obtained. The urethra and the surrounding area is prepared and draped. So as far as preparation and the draping is concerned, the universal protocol should be performed. Prior to the catheterization, the operator should wash the hand and wear sterile glove that we have seen in the male catheterization, the same. The change is the labia should be spread, urethra is identified, and the catheter should be lubricated and inserted into the urethra. So in male catheterization, the penis is held in one hand and it is inserted. But here, the labia should be spread, urethra is identified, and catheter should be lubricated and inserted into urethra. After urine has drained from the catheter, the balloon should be inflated. The catheter is attached to again closed drainage system and drainage bag, and it is positioned at the level below the bladder. It should not be kept above the bladder, below the bladder, to prevent the urinary reflux back into the bladder. So in female catheterization, medium catheter, the size of the catheters in males and females. So medium catheters, that is 16 to 18 French units, used in adult females. Large catheter 20 to 24 French used in hematuria. Now we know that if at all there is an hematuria, so hematuria means the RBC will be leaking into the urine, the blood will be there in the urine. This is called as the hematuria. In such condition, larger catheters are used so that the clogging of the catheter won't occur. If at all small catheters are used, there may be a chance that the clogging of the catheter may occur. So that's why to prevent this, the larger catheter is used. Again, the pros and cons, the clinical pearls and the pitfalls. The of this particular procedure here. So urethral identification may be difficult in obese patients, patient with a prior surgery following a childbirth, or with a prolapsed vagina or urethra. So in such condition, it will be difficult to identify the orifice. If no urine drains from the catheter after insertion in an appropriate length, the catheter may be irrigated or the balloon can be inflated with a sterile saline. And when the free saline returns, suggests that the tip is in the right location. So these are some of the pros and cons here. So moving on. So the guidelines for the catheterization that has to be followed according to Centers for the Disease Control guidelines that we follow. Catheter should only be inserted by a trained personnel, as I said earlier. The catheter should not be inserted without understanding the technique and its procedure. Catheter should only be inserted when it is necessary rather than for the convenience of the patient. It should be done only when the patient condition demands the catheterization, not the patient care personnel demands a catheterization. And it should be only be left in place as long as necessary. So the period of the catheterization should be very minimum if it is possible. So whatever the demand of the condition is there, depending upon that, catheterization should be there. So long-term catheterization is not usually advised. So to prevent such complication, alternative methods of urinary drainage should be entertained, such as condom catheters and suprapubic drainage. The smallest appropriate catheter should be selected for insertion and balloon is checked for the patency. We have identified different size of the catheters. So if you remember that we have identified the small catheters, the medium catheters and the larger catheters. So we have identified that depending upon the French units, that is 12 to 14 French units for the smaller catheter, 16 to 18 French units for the medium catheter and 20 to 24 French units for the larger catheter. So we have the condition where it has to be used, that is 12 to 14 French units for the condition of strictures, 16 to 18 units for the conditions for the adult males, and 20 to 24 the bigger ones are used for prostatic hypertrophy and the hematuria. Similarly, for adult females also we have identified 16 to 18 French, that is the medium catheter should be used for the adult males, adult females. So this should be kept in mind. So the size of the catheter should be appropriately used and all the procedures has to be done accordingly that we have discussed. Thank you.